So therapy resistance in cancer is actually very common. For prostate cancer, patient initially responds well, especially to those hormone-based therapies. However, over time, the cancer cells can find a way to escape treatment. So at those points, it's become much harder for us to manage the disease. That is why it is so important for us to understand the mechanisms behind therapy resistance. So my lab focuses on understanding how the treatment resistance happens in prostate cancer. So cancer cells, they are very resourceful. They can switch their identities, their behaviors to escape treatment. For us, we want to understand what is the reason behind it and at what step can we step in to reverse resistance. We are a very translational lab, so we start with data that we collected from patient. We use AI-based method to predict what are those genomic mutations that drives resistance. And then we test it in patient-derived tissue cultures to test our hypothesis. And eventually, with collaboration, we can develop some drugs that either degrade or removes proteins that drive resistance. So for us, it's like all patient-centered. We are hoping to find the reason why resistance occurs in prostate cancer patients, and we want to develop new drugs or testings that either predict when the resistance is going to happen, or to develop combined therapies where we can combat therapy resistance. When I was 10, one of my friends got leukemia and I was not able to do anything. I really hope when I'm at 50s, I can say, here, this is what we developed at Yale to bring hope to patients.